So in Unit 2, we're going to do the reproductive anatomy, and we're going to start with the male reproductive anatomy. So the external genitalia of a man is largely made up of a penis. And when we look at the penis, then the end of the penis here is called the glans penis. And this is an example of a circumcised man. But if they were uncircumcised, the head of the penis is covered by skin that we call the foreskin or the prepuce. So in this model, you can only see the glans penis where the prepuce is open. It's not uncommon in our society to circumcise men. And so in this model, the penis has been circumcised, and you can see the glans penis not covered by skin. And at the end of the glans penis, there's a ridge that occurs called the corona. And then most of what you're seeing of the penis anteriorly is called the body of the penis. And now in normal physiology, the urethra opening is at the end of the penis, so that we have our external urethra opening. And the urethra passes through the penis. Now, as an intermittent organ to inject semen into a vagina, the penis has to become stiff and hard. And so the penis has erectile tissue that is involved in that process. So the erectile tissue associated with the urethra and continuing into the head of the penis is called the corpus spongiosum. The erectile tissue that is superior to that or anterior to that in the flaccid penis is called the corpora cavernosa. So corpus with a US because there's only one, corpora with an A because there are two bands of this tissue. So that if we look at a transverse view of the penis where the penis has been cut, then here's the urethra, and the erectile tissue surrounding the urethra is the corpus spongiosum. These two erectile masses here are the two corpora cavernosus on left and right sides. Now, the part of the penis that continues on between a man's leg where the urethra runs into it is called the bulb of the penis. And then the penis is kept in place by connective tissue that suspends the penis from the bottom of the pelvic bone. And so this is called the suspensory ligament of the penis that we see here, this blue material that we see. So to maintain sperm production, then the testes have to be kept at lower than body temperature. So the testes descend into a sac that is suspended inferior and posterior to the penis, which is called a scrotum. The scrotum itself has a ridge midline where it fuses embryologically, which is called the raphe. And then internally, the scrotum is separated into two cavities, one for each testis. So this is the scrotal septum that we're seeing here. In the floor of the scrotum, we would have a muscle that is found down here that decreases the size of the scrotum. So it's called the dartos muscle because it actually creates folds in the scrotum when it's contracted. So when men get cold and the testes are elevated by a muscle that we're going to talk about here in a minute, then what happens is the scrotum then is partly empty because the testes are brought up. So the dartos muscle contracts to decrease the size of the scrotum during that period of time. So there's a muscle mass that we see in the inguinal canal, which is where the blood supply and the vas deferens pass through the body wall to go out into the scrotum. So we have this muscle that we see here that extends down, which is called the cremaster muscle. And it's the role of the cremaster muscle to elevate the testis, and it's the role of the dartos muscle to decrease the size of the scrotum. So when men exercise, become sexually excited, the cremaster muscle and the dartos muscle contract, and when they get cold. So the testis itself is held within the scrotum itself, and it's covered by different layers. So in this model, what we've done is we've cut the testis open so that we can actually see it. And what you can actually see is there's an outer covering over the testis and then this inner covering over the testis. So the outer covering that we're seeing here is the tunica vaginalis. And in the inner layer we're seeing here that folds in and divides the testis into compartments is the tunica albigine. The little compartments that are created by these inward folds, or septa, are called lobules. So the testis, like the lungs and like the liver, is divided into a functional unit called a lobule. Within each lobule we have this coiled tube that's called a seminiferous tubule. At the end of the coiled tube we have a short straight tube that's actually called the straight tube. And then the straight tube enters this network of tubes we see here, which is called the rete testis. So we're looking at a planar view of the testis instead of a three-dimensional view. But these lobules would be going out this way, they would be on this plane, they would be going back. So the role of the rete testis is to take many straight tubules and reduce the tubes into number until we have 4 or 5 efferent tubes coming off this side of the rete testis that enter an area where sperm is stored called the epididymis. So when you're looking at the outside of a testis that hasn't been cut, this elevation we see here is the epididymis. And so the front part of it here is called the head, and then the body, and then the tapering portion of the epididymis is called the tail. Now in this model where they've cut the epididymis open, we can actually see that the epididymis is made up of coiled tubes called the ductus epididymis, which is where sperm is stored for maturation. And then that tube coalesces into a single tube called the vas deferens. And the vas deferens, or ductus deferens, goes through the inguinal canal and then carries the sperm lateral to the bladder and to the posterior aspect of the bladder, where it terminates in an enlargement called the ampulla of ductus deferens. As we're just following the ductus epididymis, or vas, becomes the vas deferens, or ductus deferens, that then enters the inguinal canal, and as it passes through the inguinal canal, creates a point where we can have a weak area in our abdominal wall, and intestines can get pushed through this, which we would call an inguinal hernia that men get. And then it passes laterally around the bladder to the posterior aspect of the bladder. And on the posterior aspect of the bladder, we have an ampulla that stores the sperm that's going to be ejaculated. And then we have a gland that sits next to it called the seminiferous vesicles. The seminiferous vesicles produce most of seminal fluid, along with the gland that sits under the bladder called the prostate gland. So what we'll be able to see when we pull this one apart, so we can actually get a view of what's going on, is that the ampulla and the seminal vesicles drain into the urethra via a duct that goes from there. So you can see the end of the duct right here, which is the ejaculatory duct. You can see how the prostate gland sits underneath the bladder, and on the posterior wall of the bladder is where our seminiferous vesicles and the ampulla are. So when men are getting close to ejaculation, a process called emission occurs, where we get smooth muscle contractions of the wall of the ducts in the seminal vesicle, the ampulla, and that moves fluid down into the urethra inside of the prostate gland, called the prostatic urethra. And then in men, the internal urethral sphincter is in the bladder wall above the prostate, and the external urethral sphincter is part of this muscle mass we see here, which we generically call the urogenital diaphragm. But this muscle that we're seeing wrapping around here, which I'm going to show you as we rotate it, this muscle that we see wrapping around the bulb of the penis here is the bulbospongiosus muscle. And it rhythmically contracts during orgasm to create an ejaculatory event. So we have to have the external urethral sphincter here so that when we ejaculate, the semen is pushed into the urethra and not up into the bladder itself. So as we look at this model, then recall that we call the part of the urethra going through the prostate the prostatic urethra, part of the urethra going through this band of muscle, the urogenital diaphragm, the membranous urethra, and the part of the urethra entering the bulb of the penis and going through the body of the penis to the glans penis, the spongy or penile urethra. And we have a little gland that is inferior to that muscle band and inferior to the prostate gland that we see right here, which is a Cowper's gland or bobourethral gland. It secretes mucus ahead of ejaculation. So it secretes mucus into the urethra that can carry sperm. So it's one of the reasons why withdrawal methods of birth control or coitus interruptus aren't always effective, because men can get sperm being released from the end of their penis because of the activity of this little gland, the bobourethral gland or Cowper's gland. Now, when we look at the floor of the pelvis in a man, we create a triangle, which is called the peritoneal triangle by muscles. So if we put it together so we can see both sides, we have a muscle coming off the ischial tuberosities going up to near the suspensory ligament of the penis we talked about. So these are the ischiocavernosus muscles, the one we see here and here. Then we have these transverse muscles here, and they actually create a triangle, which we call the perineal triangle. And then in men, inside the perineal triangle, we have this bobourethral, bobospongiosus muscle that we can see here. So ischiocavernosus muscles, bobospongiosus muscles. These help with ejaculation. These muscles help stiffen the penis and make the erection stand up higher when men contract them.